This is Josh Hall's doing his video for MSN 572, the abdominal assessment, and my patient here is Jessica. I'm going to quickly ask for consent. Jessica, do I have consent to put your video on YouTube and so my teacher can see this assessment? Perfect. Okay, I'm going to enter the room and do an abdominal assessment. Knock, knock, knock. Hey Jessica, my name is Josh. I'm going to be doing your assessment today. Is that okay with you?
Yes, that's fine.
Perfect. I'm going to wash my hands. Okay. Jessica, what I'm going to do is I'm going to first inspect your abdomen. So what I'm going to have you do is, are you comfortable first?
Yes.
Perfect. I'm going to have you raise your shirt up
Okay.
just to the level of your ribs there.
Okay, is that okay?
That's perfect. Thank you so much. So I'm first checking, inspecting the skin for anything abnormal like scarring. I'm also doing a fluid wave test as I'm inspecting to see if there's anything out of the ordinary as with peristalsis of the abdomen or anything like that. Abdomen seems to look good, it's clean, and then I will check the backside when I do Cva Tenderness as well. Jessica, have you had any pain with your abdomen lately or anything out of the ordinary?
No.
Okay, perfect. And then when was your last bowel movement?
Today.
Perfect, okay. We've inspected, so now we're gonna auscultate the 4 quadrants, but before I do that, I'm actually gonna auscultate the arteries, the aortic artery, the renal arteries, the iliac arteries, and the femoral arteries, okay? And the aortic artery is found just under the sternum, about the same level as we would palpate for that liver. I'm gonna check first, and then I'm also gonna listen with the bell, just listening for any bruits, and the aortic artery sounds clean. The renal arteries are just to the side. The left renal artery, no bruits. Checking with the bell as well. And then also checking the right renal artery with the diaphragm and the bell as well. And those sound great. No bruits with either of those. And then checking the iliac arteries, which are just on either side of the belly button. And I'm checking with both diaphragm and bell as well. Perfect. Okay, no bruits there. I'm going to check the femoral arteries with both the diaphragm and the bell. Perfect. Femoral arteries, no bruits. Okay. We're now going to move to auscultating the quadrants of the abdomen, which is, we'll start in that right lower quadrant, move to the right upper quadrant, and then move to the left upper quadrant, and then the left lower quadrant, following the movement of the intestinal tract. Right lower quadrant, abdominal sounds, bowel sounds are normal reactive. Upper right quadrant, normal reactive as well. Left upper quadrant, normal reactive. Left lower quadrant, normal reactive as well. Okay, now we're going to move to percussing of the abdominal quadrants. And how I'll do that, I'll take my hand in that middle hand and just be tapping those quadrants, listening for any dullness. We want it to have a tympanic sound to it. A dullness sound could mean that there is something going on that we need to assess further. All 4 quadrants had a tympanic sound, which is a great sound. Okay, I'm now going to move on to percussing the liver. Just right under that right chondral line, and listening for some dullness.
Never had that done before.
Okay, and then I'm going to do the liver span. So I'm going to start from the bottom here, work my way up until I hear a dull sound, and start up here as well. And I'm going to measure where I heard that dullness happen. And roughly about a 7 centimeter span. And the dullness was found about 1 centimeter below that subchondral line. We're now going to try to percuss for the spleen couldn't hear any dullness where the spleen would be, which is a good sign. An enlarged spleen is when we would hear that dullness, which would be an issue. Okay. Now we're going to do palpations. We're going to start with a light palpation. That light palpation, we're just feeling for any pain, anything out of the ordinary. Okay, we're just going to be really soft here. And again, we're starting in that right lower quadrant, right upper to the left upper to the left lower. Okay. You having any pain there at all?
No.
While we're palpating that right lower quadrant, we could be looking for the McBurney's point, which would be appendicitis, and you can usually tell a little more with a deep palpation, which we're moving to next. So I'm going to push deeper. Are you having any pain? Upon rebound tenderness is what we would have. So no rebound tenderness, nothing with appendicitis. Moving to the right upper quadrant, just palpating a little bit further than we did with light, looking, feeling for any masses, anything hard nodules, anything out of the ordinary as well. And all 4 quadrants, there was no masses, no hard spots. Now, I'm going to have the patient take a deep breath in, and I'm going to look for Murphy's sign, which is as she breathes in and I palpate that right upper quadrant. It's a little higher than the right upper quadrant of the abdomen. It's more in the ribs. It's to feel if that gallbladder is a little inflamed, then we will be applying pressure and there will be pain. So I'm going to take a deep breath in, Jessica, and I'm going to just palpate here. Are you having any pain there?
No.
So Murphy's point is negative, McBurney's point is, or Murphy's sign is negative, McBurney's point is negative as well. So now I'm also going to do a splenic palpation here. She's going to take another deep breath in, and I'm just going to palpate where that spleen would be. Again, right under those left ribs. If it's tender there, then we know we have an issue and need to probably do some more scans. So now I'm going to check for Cva tenderness. I'm going to have the patient sit up. I'm going to inspect the back as well, and then do some light palpation to see if there's any tenderness around the kidneys. So yeah, Jessica, go ahead and sit up. It's okay if I lift your sweater up. So back as well upon inspection is clean. There's nothing, and then I'm gonna, any pain there. I'm gonna do this, her left side as well.
I gotta pee.
Okay, so Cva tenderness, not having any, so kidneys are good. The assessment overall and the abdominal assessment of Jessica is good. And there's nothing to report there. Everything is within normal limits for her. Thank you, Jessica.
Thank you.
I would wash my hands and leave the room.